We're at TV47KE on Twitter. Facebook is TV47 Kenya, YouTube and Instagram as well. And to the top story today, the Kenyan government has on Wednesday rolled out the home-based care protocol for asymptomatic COVID-19 patients who make up to 80% of the infected population. However, home-based care is not a new concept in Kenya. Shiphra has had to take care of her mom from home, and this is her experience.
This is the room where Jane Wamboi breathed her last. Now, her granddaughter uses this modest room in the two-bedroom apartment which her daughter, Shiphra Waireri, has decided not to move out of. Shiphra was nursing her mother at home when she died of cancer last year.
That morning she actually said, I think it's very soon. And I remember telling her there's nothing like that. Mom, you're not going anywhere, you're going to stay here. That morning, in fact, she woke up, stretched to the seat, sat on the seat a bit. She was very happy that morning. And everything was going on as usual. But when I left to go to get her some medicine, I remember the nurse called me. She said, hi, Mom is not breathing very well, so I've called the doctor. And I told her, fine, that's okay. Just call the doctor, please keep me updated. But even before she could update me, because I remember it was around 4 p.m., I missed some calls because I was on my way back. I didn't hear the phone ring. I remember just walking up the stairs and knowing when I heard the cries and all, I knew it was done.
Shiphra was nursing her mother at home when she died of cancer last year. While many Kenyans have raised concerns about the viability of home-based care for small households, Shiphra was able to care for her ailing mother, who had been diagnosed with stage 4 cancer in this house. The house is a replica of many urban households in Kenya.
It is doable even in a small environment. We were able to fix even the equipment and have them running. In fact, if you'd walked in, you would have thought you were in a hospital. I think the first thing I did when we got her home is just tell everyone, now Mom is home. And because of the situation, we cannot have access to visitors as much as we used to. So even when we had visitors, they would come to the sitting room and pray, but not really go to her room, because you also want to limit any chance of contamination or infections that could progress the situation downward.
She explains what home-based care entails.
To help them clean her. Because remember, at this time, she cannot do anything on her own. So I'd wake up in the morning, prepare her, just basically make sure that she's had her medicine. 2 is help the nurses as they clean her up, because she's my mom, so you want to be part of that process. And then also get ready for the physiotherapist, make sure whatever he needs is available for him. Most of the time, in fact, in the afternoons, I remember I would be out looking because sometimes you need different medicines or there's something that the home-based nurses will be needing, so you're out looking for that. Also preparing her meals. I think that was the biggest part of it. People want to see how she's progressing, but basically it's being around. The nurses will help to take care of her, because for her it was quite advanced. You need someone who understands how to use the oxygen tank, how to use the oxygen ventilator, so we needed nurses. But on a regular basis, as far as we're concerned, the biggest bit is making sure that she's cleaned up and that she's having her meals.
While healthcare professionals are available, the family must provide support to ensure the patient is comfortable.
I think you have to be very positive from the very beginning, because as much as you're providing the care, emotionally this person is looking to you for encouragement, for that comfort, to know that they can go through what it is they're going through. So as you're working towards making sure you have everything necessary, the very first thing you need to do is be positive. Maintain that positivity, because when they see you are encouraged, they also get encouraged to continue living on and to fight the disease. Make that person feel that they are loved, that they are well attended to, because in some of these situations, especially for the terminal illnesses, I'd say, is that they want to feel that their last moments are moments that they're happy with the people that they love and that they're comfortable with them.
And here are the lessons she learned about home-based care.
Be very emotionally detached from the outcome, because one of the things that you need to do is, sometimes we struggle so much, just trying to figure out, will this person get here, and we forget to do what needs to be done. So one thing is understand what needs to be done, have a schedule, because one of the things that the person will need is a very clear schedule of maybe times when they take their medicine, the times when their meals need to be ready. You need to organize the visits if there are any visits that are coming in from the doctors or a nurse from outside, and then with the help of the home-based nurses, because they are there to guide you, is know what they need beforehand, so that you are able to have everything in proximity to ensure that everything runs well. It's of course to educate yourself, to understand what to expect. With disease, there are different stages of a disease. Initially it's very mild, and as you progress, depending on how the situation is, it could go, So at every stage you need to understand what to expect.
Although home-based care has been achieved before, the ability to actualize the same for COVID-19 patients will be determined by the amount of discipline and resilience by Kenyans. It is important to remember that COVID-19 is a highly contagious disease, and isolation may be part of the home-based care protocol.
Thank you so much, Shiphra, for that story and for agreeing to speak on such a sensitive topic, and for all the lessons to our viewers tonight. Thank you, Nancy Kimuyu, as well, for that narration.